Yes, top of the moment. Top of the moment to you anywhere where they watch us from. Slimity can feel like to disturb somebody.
Like you did not miss me.
I miss you so much. It's a lovely Saturday. You're welcome to Health Matta. You know what they do for this program now. We take discuss everything we dey health related. And as it take me, nothing else where we go they talk about today, past the one where the whole world they talk about, that is the coronavirus pandemic. Call it COVID-19. As the case may be, our doctor is here. Done ready to make sure saying dissect everything we get to do with coronavirus. Good morning, sir.
Good morning, Chief.
How you doing?
Fine, thank you. Slimmers.
Yeah. Oh.
That's our new greeting pattern.
Try and get used to that though.
Yes, sir.
But it's
yes,
fine.
Sir.
Good to see you.
Yeah, good to see you too.
Good morning. The only doctor that is old. You're wearing green and green.
You're looking sweet as
Thank
always.
you.
Good morning, viewers at home and around the world. We're happy to be back today on this episode of Health Matter on WAP TV.
Yes, sir.
We'll be talking about coronavirus pandemic. It's a topic we started few months ago. Okay. Basically, we'll be given updates on the current happenings on the global stage, as well as in our own environment. Okay. I want to start with a good news today.
Okay.
The index case, talking about the Italian who was the first case diagnosed in Nigeria, has been discharged from the hospital.
Wow.
Okay, I saw a snapshot. We might see a picture of him alongside the Lagos State Commissioner of Health, Professor Bayomi. Okay, we'll have that on our screen at the moment. And a number of medical personnel and paramedics. You can see him standing at the middle.
The one with the arrow.
Yes, somebody was asking me, what is the name of the index case? I said it's Mr. Italian. Okay, so people can survive this scourge. People can survive this scourge. On the global stage too, a total of 91,912 persons have actually recovered from this scourge. I also would like to point out that 80% of people who may pick up the infection may actually present with little or no symptoms or mild disease, which may not require hospitalization. It's only in 20% of persons that pick up this disease that will require hospitalization. Okay, so there's some. We can see we still have some light at the end of a very dark tunnel. Okay. Let me also release some of the latest updates we have on our hands as of today. Globally, a total of 275,944 individuals have been affected. 275,944 individuals have been infected. Okay. Out of this, the death toll has surged beyond 11,000. Currently stands at 11,398. These were people who couldn't survive the disease, and it's a big, big pity. The world is at a crossroad at the moment. The most developed of nations are having a Herculean task, ditto for all other nations of the world. As we speak, America recorded a total of 5,859 new cases in the last 24 hours. 5,859 new cases, bringing the total of people that have been stricken with this scourge in America to 19,648. Italy, at the moment, recorded in the last 24 hours a total of 5,986 new cases. So both Italy and America went beyond 5,000 over a period of 24 hours. Within this period of time, Italy also recorded 627 deaths in one single day. 627. You can imagine. It is frightening. Okay? But we shouldn't switch up our panic mode. What we need to switch on is our prevention mode. Okay? It is frightening. Next to Italy, in terms of people who had the highest number of deaths, is Spain. 262 people died in Spain in one single day. Iran, 149 died in one single day. So at the moment, China still tops the list. But I can tell you that the number of deaths currently is with Italy. A total of 4,032 persons have died, have lost their lives in Italy, and this is not good enough. At the beginning of this episode, or epidemic, as it was initially called, currently it is a pandemic. What does pandemic mean? A disease of worldwide distribution. Okay? Is everywhere. It can be found in all continents of the world except one. Antarctica. That's the one that is currently does not have it. So China has a total of 81,008 persons affected at the moment. New cases in China, of course, they've been reporting very low figure. New cases in China in the last 24 hours was just 41. Wuhan, which was the city where this whole problem started, have gone for 3 days without recording any new case. 3 consecutive days without recording any new case. The only cases that have been recorded in China lately are actually imported cases, just similar to what we have in Nigeria at the moment. So you have China on the list. Next to them is Italy with 47,021 people that have been affected. Spain, 21,000. Germany, 91,848. US, 19,648. Iran, 19,644. And then you have France. South Korea too, surprisingly, just like China, they've been doing very well, and they've been reporting very low numbers. Not so for the African sub-region. At the moment, we have Egypt topping the list with a total of 285 persons affected in that country. Next to them is South Africa with about 202 persons affected. After South Africa, you have Algeria with 94 persons affected. Next to Algeria is Morocco with 86 individuals. And then you have Senegal with 47 persons stricken with this scourge. And then you have Burkina Faso. They've recorded 40 cases. And then after that, you have Cameroon with 27 cases. And of course, our own country, Nigeria, with 11 cases, no longer 12.
Wow. Okay, that's good.
Okay, we will still count it. One person has been discharged though, so we will still say we have 12 in Nigeria, but one has recovered. So that's a good news. And we are looking forward to having all of them, okay, recovering in no distant time. That will be a landmark achievement. But more than anything else, our focus should be on what we can do to prevent and mitigate further spread. And I'm happy with the responses that are coming from government circles. The federal government has drawn the first blood by putting a ban from citizens from some certain countries of the world. Okay, I understand plans are underway to shut some airports. If the information I have is anything to go by, that about 2 international airports have been shut already. I can't confirm that, okay, but I do know that schools, almost in all the states of the Federation, have closed, and everybody have asked to go back home. Also in Ekiti State, the governor has actually declared that the civil servants can actually work from home. All of these things are to implement preventive measures, to put preventive measures in place, okay? The concept of social distancing, okay, so that we will be gathering together the way we usually do, okay? So it's a new normal. It's going to be a new normal for us Nigerians. A number of things will have to change if we actually want to stay protected from this disease, ranging from our usual pattern of greetings, handshakes, hugging, and what have you. Okay, so the concept of social distancing is important when we are talking about prevention in this case. And what that means is social distancing, you have to give, if in public, you have to give at least 1.8 meters.
6 feet.
That's about 6 feet from the person next to you. You can see the picture we have on our screen at the moment. Okay? These are people who are trying to withdraw some money from the ATM.
Right,
You can see the distance between each and every one of them. That is what we should have. We should also implement stuff like this when we are getting into supermarkets to buy stuffs. Social distancing must be implemented in all public places. I do know that over 1,000 people are currently being followed up in Nigeria. They were asked to be on self-isolation. But you and I know what is obtainable. Even in Lombardy, northern part of Italy, where the city has been placed on a lockdown for a number of days now, people still don't obey. You still see people breaking the rules. Okay, so that actually made them to bring in soldiers to enforce it. Okay, so when you say people should self-isolate, we are begging on people to please obey the directive. It's to save you and to save your family and to save all Nigerians. It is for our own good. Okay, so the concept of social distancing to flatten the curve, I will explain what that means. A good number of us must have been saying this. Social distancing to flatten the curve. Now, what that means is that with social distancing, the closures that we are seeing, avoiding gathering, mass gathering, public gathering, churches, mosque, football, what have you.
Party.
Okay, of course, parties. Now, when we're able to do this, it will help us to mitigate against further spread of the disease. Okay, so that if you have a graph, okay, where you don't have preventive mechanism in place and the disease is allowed to thrive, you're going to have the graph will jump up and then curve. It gets to a distance, it passes the capacity of that particular country, the health capacity of that particular country, the ability to manage the healthcare system they have. Once it surpasses the ability to handle, okay, that we'll have the curve before us. Okay, so flattening the curve. So you discover that without protective measures, you see a curve, a peak, just like a mountain, that will go way, way beyond the healthcare system capacity of a particular country. Okay,
I think in Indonesia now this is happening.
Now, but once you see the second I've forgotten my mathematics here. the second
slope.
No, it's not slope. That looks like mountain. The second mountain you can see, if I'm permitted to use it. Okay. Now you can see that is about the health capacity, the healthcare system capacity of that particular environment. So with protective measure, we can get it to this level.
Yes,
okay, but without protective measures, it could go beyond what Nigerian healthcare system can take care of. Just like what is currently happening in Italy. At the moment, if you're an elderly person in Italy and you come down with this disease,
at 80 years,
wow, 60 and above, you stand, you're on a disadvantage, because if the information we are hearing is anything to go by, that they're paying more attention to the younger people than the elderly ones. Of course, that accounts for the reason why we have large number of deaths in that part of the world, and it's so sad. Okay, one of the other things that we need to do to prevent, if you know you have a pre-existing disease, it could be diabetes, it could be hypertension, it could be a cardiovascular disease, it could be cancer, it could be HIV, and others. You need to keep yourself away from crowd. If possible, you need to stay indoors as much as possible. Avoid crowded place at this time. Ditto for people who are elderly as well. People who are older than the age of 65. Okay? Ditto for people who are elderly. Okay? So you need to avoid crowd as much as possible. Coronavirus, like we always say, is a large family of viruses. Predominantly, animals are affected, but a few of them have been seen causing havoc, causing a number of diseases in man. We are discussing today about coronavirus, which has officially been named COVID-19. That is the disease. The name of the virus that causes COVID-19 is SARS-CoV-2. Okay. Other variants, of coronaviruses that we have seen before in the world. One dates back to year 2002 and 2003, when SARS, severe acute respiratory syndrome, emanated from China, but didn't kill as much as what we are seeing now. Okay. After that, again, in 2012, we saw MERS coronavirus, Middle East respiratory syndrome coronavirus, that emanated from Arabian Peninsula. It killed about the same number of people, okay, that SARS affected, less than 1,000, about 800 or thereabout. But what we are seeing now is unprecedented.
Okay, Dr. Bat, we'll have to hold you a bit so that we'll go on this break. Yeah. Most definitely, a lot of questions await you from us here and from our viewers at home. So please be prepared. Thank you very much. We will be back.
Yes.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold, and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases, and we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
Yes, you've heard it from Grebiesius, and you're welcome back to the show. This time around, we open the phone lines, and we go the sample question, give doctor. We will come to clarify us on top. Baby.
Yes, dear.
If you are ready, please.
Yes, okay, so let me open the phone lines so that I know say so many questions going to pop up this morning. Even Dr. Bat is ready because I've got my questions waiting. 08105434981 or 08173147589. Please help us turn down your TV volume so that we can take as many calls as we can this morning. Dr. Bat, I have a couple of questions I've written here. And
So we'll just do one.
Okay, we'll do one. Okay.
I'm not surprised.
Okay, I think let me start with the issue of chloroquine. There was something I actually wanted to start with, but let me start with the issue of chloroquine. And that was because I was opportune to watch. I joined the president of the United States when he was actually talking about the use of chloroquine, and the health minister there, you know, when they were addressing that and all of that. Now, bringing it down to Nigeria, I saw something in the news yesterday where they said the health officials or NMA are already making preparations. It's still under trial, but people are already, by now, I'm asking.
People are already abusing, please.
They're already abusing because somebody bought yesterday, an actor bought yesterday for 4,000 naira. Now, I'm asking, really, is there a possibility, or are there possibilities of chloroquine being a cure to coronavirus? That is one. And then secondly, what do you have to say about the usage of lime and hot water, warm water, you know, still on coronavirus? Because those are videos I've seen so far.
Thank you very much. But before that, let's take Wire.
Okay, Wire, good morning.
Coming through.
Good morning, Wire.
Good morning, doctor.
Good morning. Good morning, Wire.
Yes.
How is Delta State today?
Rather, I want to know what was the real causes of this particular virus before we think about prevention.
The real cause.
Okay. Thank you very much, Wire.
Okay.
The cause, the real cause, I want to believe is trying to ask where did it originate from? Is it from an animal? Did it come from a human? Not just in terms of location. Okay. The cause at the moment is currently unknown. Okay. But there is some experts or authorities that have said that it could be most likely from animal kingdom. Okay. And then a number of animals too have been implicated. Initially, some experts said most likely it could be snake. But as more information came out, they actually did what is referred to as genomic sequencing. Okay. That has to do with the analysis of the DNA and all whatnot. Okay, so they actually came out and said that about over 85% was close to what can be found in bats. So at the moment, it is believed that it may have originated from bats. Okay, but the bats, was it that bats played an intermediary role to humans? That is still unknown at this time. Okay, but having said that it originated from animal kingdom, we are much more worried with the person-to-person transmission that we are currently having. And of course, that is what is largely responsible for the pandemic that we have on our hands. Okay, but before I take your question, I want to, first of all, pay homage and then thank the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, and his team, as well as to all the medical professionals and paramedics that are working on this disease all over the world. From all of us, it is kudos.
Yes,
may the Lord strengthen you
Amen.
all.
Okay, Ndubusi, good morning.
Said the calls are coming through.
Good morning.
How are you there, sir?
Fine.
Please go ahead with your question and reduce your volume.
Okay. Good morning, sir.
Good morning, my brother. How are you today?
Everything fine. Please, my question is that what can we do? You know, what people can do to prevent that sickness? Because
thank you very much. Thank you very much. Very important.
Measure.
Yes. What can we do as Nigerians to prevent?
Just listen up, Ndubusi.
We got you.
Listen, we got your point.
What can we do to prevent this sickness? Okay. Number one, we need to obey the directive that are coming from our government.
Yeah.
That should be number one. They are not going to misdirect us. Okay. By that I mean
social distancing.
No. From Ministry of Health, from Minister of Health, from Commissioners of Health, from state government, once they give a directive, we must obey them. That is the first thing we need to do, because they are not going to misdirect us, like I said before. Okay? Now, on a personal level, if they ask us to avoid coming into crowded places, if they ask us to stop having a crowd of more than 30 persons, some states say more than 20 persons, some states say not more than 50 persons.
Yeah.
Okay? We should obey that to the letter. It is to our own good. Okay? Other than that, on the personal level, we should develop good hygienic practices. Number one, we should wash our hands always under running water with soap, not a tablet soap that can be dispensed on your hand. Okay? Apart from that, if you're sick, you should remain indoors. If you're presenting with cough, sore throat, and a number of other symptoms at this time, you should remain indoors. Time was when you could just walk into any hospital with those symptoms. This time around, you should remain indoors. Find a way of getting across to your hospital. Tell them ahead of time before you get there that you have these symptoms, so that they can make adequate preparations for you. Okay? That is important. They can make adequate preparation for you. Prepare ahead of time that you're coming. And the pattern, where you get to the hospital is equally important.
Sorry, sir. We have Benjamin from Edo. Good morning, Benjamin.
Good morning, sir.
How are you doing?
I'm fine, sir.
Okay, our doctor is here. Go ahead with your question.
Yeah, the question I want to ask is can mosquitoes spread this virus?
Thank you very much. That myth has been debunked. Mosquitoes cannot spread the virus. We have a number of them along that line. The question she asked, I will treat that shortly. Thank you very much.
Thank you.
Now, coming to the issue of the use of chloroquine and hydroxychloroquine. Regardless of what the very respected American president must have said about chloroquine, the use of chloroquine, a lot of authorities have actually not agreed with his position on that. Okay? I will tell you that a number of authorities, a number of media houses have actually done a fact check on what he said, that it was a government-approved, FDA-approved drug. Okay, they came out to say that FDA is here to approve that drug. As a matter of fact, one of the commissioner who was with him, that spoke shortly after him at that briefing, actually said things that were not in conformity with what the president said. Okay, so regardless of what he has said, the most important thing we need to take out of it is that hydroxychloroquine with chloroquine and another drug, remdesivir, are drugs that are undergoing clinical trials at the moment. Before you can come out to say any drug can treat this, you must have done a robust and adequate clinical trials before it can be certified, before FDA can give the approval. But what Trump is asking them to do, in fairness to him, is to hasten up, avoid all manner of administrative bottlenecks that could hinder progress, so that they should hasten up so that we can get this thing done. Okay? Now, the other side of the information he gave has actually, a lot of people understood it the way he has said it, and of course, it's beginning to cause problem. People are now beginning to buy drugs that ordinarily should come with prescription. Okay? For instance, if as a doctor I'm prescribing CQ, we call it CQ, chloroquine for someone in the hospital, there is a particular pattern that he should follow.
Which is actually a banned drug.
No, it's not. It's not.
Because we react, I react to the paper.
No. He's not a banned drug, so to say, because I tell you that it has been in use in Nigeria. I'm coming. I will address that. It has been in use in Nigeria and other places for more than 70 years. It is no longer a first-line treatment for malaria. Not that it's a banned drug. It's not banned.
No, we use the word because that was how it was used in the paper.
No.
They said it's only doctors that can recommend you to.
We are saying the same thing. It's a prescription-only drug. Okay? People who understand in the medical parlance, the dose is 442. I won't say more than that. Okay? Now, but in a situation where you've said this can cure it, it may mislead a number of people, which is what we are currently seeing. People are now buying, taking more than the actual dose they should actually have taken. The challenges with the chloroquine treatment for now is that there is still a lot of unknowns about it. WHO said just last month that no drug has been approved as a treatment for COVID-19.
Please, so
Including the chloroquine and the hydroxychloroquine. Okay, no drug has been proven to be effective, has been recommended by the authorities for treatment. However, that said, there have been some encouraging results. A number of drugs have been tried, not just the chloroquine or the hydroxychloroquine. Remdesivir, for instance, was a drug that was invented for treatment of Ebola.
Okay, sorry, we have Jude from FCT.
FCT.
Good morning, Jude.
Thank you very much, sir. Good morning.
Good morning.
Jude, Mr. Jude.
I want to find out if every kind of hospital have the capacity to handle this pandemic outbreak.
Okay, thank you.
Thank you very much, Jude. At the moment, is not every hospital, but we are getting there. I say we are getting there because, for instance, I'm in Lagos. Okay, those of us who are in Lagos, we have had seminars. One was anchored by WHO, okay, for medical directors, owners of hospitals. The other one was handled by Nigeria Center for Disease and Control, NCDC, okay? And the essence is to make hospitals, all our hospitals, if possible, to equip us to the extent that we can handle this scourge. But at the moment, not every hospital can handle that. One of the challenges that we're having along that line is that the PPE, personal protective equipment that doctors need to be able to carry out duties without being affected are currently in short supply. Okay, a number of hospitals cannot get even to acquire, even to buy, and it's a big problem. Just about, I think yesterday morning, the news came out that about 2,600 medical personnel have been affected in Italy. It is worrisome.
Okay, doctor, let's look at it from this angle, because this morning I took my time and I did a lot about this coronavirus, and I heard Anthony Stephen, that's the American immunologist, spoke a lot on this. First, sir, can COVID-19, can it actually be sustained in the air, like we are beginning to hear from people that it can be in the air? Why some people say that it is only when there's droplets? What's your belief on this? Can COVID-19 sustain in the air? That's one. Then number two, speaking of sanitizer, I've seen a lot of banks putting sanitizer and everything. I want you to sensitize us, sir. The issue of sanitizer, is it just any sanitizer or we need...
There must be content, alcohol.
Let me take the two, but first I have an outstanding from her.
Okay, the lime and water.
Yes, the lime and water is a myth. It is not true. Okay? Now, the lime and water can also not do anything. There is no scientific evidence that it can treat COVID-19. Okay. There's also this. There's also another one that people should drink as much water as possible. It's good to drink as much water as possible for some other health reasons, but surely not in treatment, not a preventive measure, not a prophylactic measure for COVID-19. Okay. Now, coming to your question.
The issue of sanitizer.
Yes, we have John from FCT. Okay. John, good morning.
Good morning.
Good morning, John. How are you doing?
Fine, good morning.
Yeah.
Yeah, I want to ask a question.
Yeah, go ahead, sir.
Okay, we heard that there should be no gathering of more than 50 or 30 people.
Okay.
So to that effect, some schools have shut down, some companies and other stuff. So my question is, what about religion settings? Are they going to shut down as well?
Okay. Yes, the information I gathered too, because I asked a question, I was expecting you to ask about markets. I don't think I've had markets mentioned. Okay, I don't think I've had that mentioned, but I've had religious centers mentioned. The directive extends also to religious settings. Okay, so that's all I can say along that line.
Okay, to choose.
Now, to your question, the sanitizer that we're advising people to use are alcohol-based sanitizer. Yes. And if you get one, before you buy any sanitizer, look for the alcohol percentage. Usually it should be on the label on the body of the
cover,
container. It must be at least 60 or 70% alcohol.
Good.
Okay, and now the alcohol too that we are talking about is not the type you can find in beer. We are not asking people.
Because some
Some people are already cutting
to go on boozing and no, that's not what we are saying.
That's
But at the matter of fact,
I'm
this
telling
degree of alcohol cannot be consumed.
Oh,
wow.
If you consume it, you're a goner. Okay, so the degree of alcohol that it contains cannot be consumed. Now, your second question.
The second question about maybe COVID-19 can
Thank you
live
very
in the
much.
air.
Thank you very much. I've also seen a lot, like I said at the beginning, there are still a lot of unknowns, okay? But what we know at this moment, what we know at this time is that, yes, it is not airborne.
okay.
In the sense that you can't just fly into the air and of course you get it. Okay, but it comes out of droplets that have been emitted, that have been pushed out by an infected person. It could be as a result of sneezing or coughing into the air. That is why we are campaigning for people to maintain social distancing. At least 1.8 meters from another person standing beside you, which translates to about 6 feet. Is a lot of distance. So that should such a person cough or sneeze, it will not get to where you are.
Doctor,
you can see a picture. Now, I also want to talk about very quickly.
Okay, sir.
On this picture, you can also see that people are putting on face mask.
Okay.
Okay. The use of face mask, a number of authorities have actually addressed the issue. Face mask should be for people who have infections, not just COVID-19 now.
Okay.
Anybody who is coughing and sneezing, and you know you have cough and sneezing, you should use face mask to prevent you from affecting or infecting people around you.
Sorry, sir.
Not for people who are well.
Michael, good morning. Good morning, Michael.
Yeah, good morning.
Yeah, quickly to the question.
Yeah, I would like to know. There's this issue concerning. Yes, good morning, my brother.
Good morning, sir.
Yes, I would like to ask a question, please. There is this issue concerning doctors going on strike while we have this pandemic on ground. I would need to understand why would doctors go on strike when the country actually needs their help really bad at this period.
Okay, thank you, Michael. So.
Thank you very much, Michael. I also read what you talked about, but I don't think it is all the doctors that are going on strike. I think it has to do with some particular states, 1 or 2 states, if I'm not mistaken. I don't have enough information on that, but I can tell you that the teaching hospitals, the general hospitals, in most places, okay, we are at work. We are not going on strike. If anything, we are going to call out people who have retired to come and join us in this fight. It's a collective responsibility. Okay, so it requires some degree of patriotism from anybody at this time. So on a personal note, I think any other thing that will affect our fight against this cause should be relegated to the background.
I think we cannot definitely finish it today, Doctor, but next week we will definitely pick up from it because there are still a lot of questions.
Thank you. Don't switch on the panic mode. What you need to switch on is the prevention mode. We'll see you next week.
Well, on that, we say thank you very much. We on the audience watch. Other lovely programs still they lined up. Slimity, 1 to 2, top 5. So it will still come up. Because, Doctor, the issue of heat, say maybe the thing they survive.
I said weather condition. I think
it has been debunked. Heat does not do anything.
So the weather does
but
not
if
anything.
it doesn't do anything, sir,
you can see some
alcohol.
of the African countries we mentioned.
Okay, but the essence of alcohol in the sanitizer, sir, we know say now because of
the chemical, not because of the heat.
Well, Doctor has quickly done justice to that. On top of that, thank you very much from every one of us.
Yes, thank you. Please, social distance. They don't